Greetings, everyone. Welcome to the LSE for today's event on food security in Africa after COVID-19. So my name is Declan Conway, and I'm a Professorial Research Fellow in the Grantham Research Institute at LSE, and I'm going to be chairing the discussion today. And for that, I'm very pleased to welcome to this session three highly experienced panelists. And the first of those is Dr. Miltone Ayieko, who is the Executive Director of Tegemeo Institute of Agricultural Policy and Development at Egerton University in Kenya. And Miltone is a seasoned agricultural policy researcher. He's held various positions, including being Regional Coordinator of the Integrated Seed Sector Development in Africa. And then our second panelist is Professor Rachel Bezner-Kerr, who is a Professor of Development Sociology at Cornell University. And she is the Soils, Food and Healthy Communities Research Coordinator and Project Director of the Malawi Farmer to Farmer Agroecology Project. And then thirdly, we have Dr. Leena Koni Hoffmann, who is an Associate Fellow of the Africa Programme at Chatham House and the Nigeria Country Lead for the Africa Programme's Social Norms and Accountable Governance Project. She's also a member of the International Advisory Board of SOS Sahel. So those are our three panelists, and the theme for the day then is an exploration of how the COVID-19 pandemic is set to radically increase food insecurity in Africa and to exacerbating an issue that's only worsened in recent years. So the World Bank has warned recently that Africa is heading from a health crisis into a food crisis, and the United Nations predicts the rate of chronic malnutrition over the next 12 months could double. Lockdowns have disrupted the continent's supply chains and led to rising unemployment. At the same time, locust swarms, successive years of drought in southern Africa have led to repeated crop failures. So African countries are now more reliant on food imports at a time when international markets are experiencing unprecedented changes. While government and international interventions are already underway, many questions remain about the scale of their delivery. What can be done to address the upcoming emergency? If regional or global collaboration is needed, how and when can this be delivered for those most in need? So that's the theme for the event and the context. And this is hosted by LSE's Firoz Lalji Centre for Africa, which serves to promote independent academic research and teaching, open and issue-oriented debate, and evidence-based policy making. And the centre tries to connect social science disciplines and works in partnership with Africa to bring African voices to global debates. In terms of the format for the session today, our panelists are going to speak to the topic for 10 minutes and for each of them, and then we'll engage in a discussion between the four of us for roughly 20-25 minutes, and then we'll open the floor to yourselves and take questions for another 25 minutes. So I'm going to hand over to our first speaker now, Dr. Miltone. So Miltone, if you would like to take the floor. I think you are going to share your screen to present some slides as you talk. So over to you. Thank you.
Right. Thank you very much and for the opportunity, and I'm very delighted to be here this afternoon to share with you some thoughts on the big topic today about food security in Africa after COVID-19. I would want to kindly ask Kojo to allow me host privileges so that I can share the screen. So thank you very much once again. So in addition to the introduction that I've been given, I'm also the chair of the regional network of national agricultural policy. It's a group of 10 regional national agricultural research policy research institutes in Africa. In short, it's called RENAPRI. So I'll be sharing with you just a few highlights of the policy, food security policy in general, in sub-Saharan Africa, and then come down to the COVID situation and share a few highlights from the Kenyan case, which we can learn from, and finally give some thoughts on what can be done in the short and long term. So we are, these are some of the stylized facts that we have been seeing flying in documents, in publications. We know that agriculture is still the key driver of economy, sub-Saharan African economies, in terms of production, in terms of incomes. And as we can see, compared to other regions, we see that most of the countries derive their livelihoods through agriculture. Of course, within Africa, we are seeing currently agriculture contributing about just slightly over 15%. But this varies country to country. Ethiopia, we have almost 50%, Rwanda 40%, Kenya, we are talking about 27%. So agriculture is really important driver of the economy. But what we have seen over the years is that African, sub-Saharan African productivity has been lagging behind the population growth, and also lagging behind other regions. For example, if you look at the cereal yields, sub-Saharan Africa average about 1.6 tons per hectare, compared to other regions which are in the range of 3, 4 and above. But our population growth has also been higher compared to other regions, and this is likely to be higher even as we move into the future. That should really pose a challenge to food security, since agriculture productivity must grow faster than the population in order to guarantee food security. Looking at our production and our productivities, the fact that we are our productivity is low, our consumption and demand therefore are higher, we have to bridge this gap by imports. So in this slide, I just want to show the highlights on how much we import and of various food items. First slide, you see there that the import for wheat and rice has been higher. And these are two commodities that sub-Saharan Africa has been importing heavily. The same with maize and other grain, other coarse grains. We are seeing that we have to bridge our consumption, our production gaps with the imports. Yet we do have potential to increase production. I think in Africa we still have large chunks of arable land that can be exploited. I think the challenge that we've been having is the use of productivity enhancing inputs that has been low, as you can see in the right side of the chart there, where sub-Saharan African use of fertilizer, the consumption of fertilizer is low, very low compared to the other regions. Now, currently, beginning last year and rolling into this year, the challenges that have been facing food security within the region has been mainly issues to do with the weather changes. We've seen, I'll say a little bit on that. We've also had, a desert locust invasion, but of late, and which is the main subject of today's discussion, is the corona pandemic, which, as we have seen and noted, has interrupted food supply systems and also has posed challenges to production and as well as the economic effects. So zeroing in on into Kenya, where we have some evidence, and this is where we are working. Looking at the locust invasion, of course, we've seen the movement of locusts from the late last year and early this year. And as of February, as we can see, we had large chunks of swarms of locusts in the northern part and moving into almost the central parts of Kenya. And we also had a big group of hopper bands, those are the bands that are breeding and then turning into the adult swarms as well. And the effect, though not noticeable, because this came late last year when most of the crop was maturing and ready for harvest, and early this year before the planting season, was more on the effect on the forage for animals, especially in the northern part of Kenya, where the main livelihood is livestock production. So we see this locust invasion affecting forage production, forage supplies in the area, and also therefore the livestock production and also milk production. As we see, as this progressed into April and March, now we are seeing more swarms and fewer breeding stock, the hopper bands. And that means that now, as the swarms increase, then their activity also increases in terms of how much vegetation they can be able to consume. What we are seeing now moving into the future is that these swarms may go back for breeding purposes, because they do breed in warm areas. And the key message I want to pick out from this is that as the locust invasion ravages the parts of Africa, I think the most important thing is to have a surveillance, so that we are able to monitor the movement and also coordinate between countries on how to address them. We've seen the interventions that have been put in place include digging trenches and then having them banned. The government of Kenya, for example, trained about 600 National Youth Service recruits on surveillance and also spraying. We've seen also support, technical support, and as well as financial support from organizations such as FAO and other development partners to help with aerial spraying and as well as vehicle-mounted sprays. But just when the country was focusing on the locusts, the COVID-19 came through and disarranged the intervention efforts. And currently in Kenya, the government has embarked on a study to evaluate the effects of this desert locust on production, as well of crops and livestock, but also on biodiversity, as well as on livelihoods. Now, in addition to the locusts, we've had weather, adverse weather patterns. Beginning last year, the last year's cropping period, we had a late onset of rains during the March, April, and May, which is the main production season in Kenya. And that meant that the farming activities were delayed, and the rainfall for the year was near average, but in other cases below average, and it was poorly distributed. But towards the end of the year, when the crop now was maturing and ready for harvest, we also saw heavy rains coming on board in October, in November, and December that disrupted harvests. And therefore, this meant that that's just a picture of the floods that were experienced during that time. But around this time, we are seeing that there was an expected or an estimated 10,000 acres of land that was destroyed, of cropland that was destroyed during that period. And this rains, continued into January and also through to February of this year, meaning that the production year for this, the production period for this year began earlier, began in mid-February and early March, which is early compared to most of the years that we've had. And our prediction is that we will have above normal rain, which means that we may also have very good yields at the end of the day. Now, coupled with all this is now the big talk, which is the COVID-19, which, as we are aware, has disrupted a number of economic activities, both at the rural and as well as the urban areas. In Kenya, we have tracked the policies during this period that we feel have affected the policy environment. And just in mid-March, we had the government closed all institutions, all learning institutions. The government also ordered that people, as much as possible, should work from home, especially those who are on non-essential government activities. We also saw pronouncement of no gatherings, no social gatherings, no weddings. Visitations to the malls were really restricted. Churches have been closed, bars have been closed. But in addition to that, I think the key things that we see here is the government imposed a dawn to dusk curfew, and also banned international flights except cargo. The effect of this has been that food has not been able to move freely between the rural to the urban markets, but also the activities at the rural areas have been affected due to this social distancing and the curfews that have been imposed. We've also seen ban or cessation of movement between the rural and the major urban cities like Nairobi, Mombasa, Kwale, and Kilifi. That has been in effect for now more than 6 weeks, and we still do not know how long that will last. And so the total effect of all this has been that the food supply systems have been affected, whether they are the formal food systems or the informal food systems. So, for example, we are seeing that with the closure of the schools and the malls, there's that consumption group that are now food is not being supplied to, and that has affected the movement of food as well. We're also seeing that there have been problems with the delivery of food into the major urban centers, especially the fresh produce that move from the rural areas to urban centers. So that has really been affected. We've also seen some disruption with the movement from, the aggregation of food from the rural areas, because the local markets are not, at some point were not fully operational, and therefore even aggregating food in order to bring to the urban centers was difficult. Now, what has been the effect, therefore, on the prices? For example, in this slide, I show the prices year to year for specific months, and we can see that the prices have been fairly moving in, have been increasing gently for maize up to 2019, where we had a very sharp dip, and that dip was mainly due to a bumper harvest which we had in during the 2018-2019 cropping year. But from 2019, we see, especially for the month of January, but also from the month of February, we are seeing that prices are increasing and almost reaching the highs of 2018 when we had the one of the worst droughts in Kenya. And so we are, while we do not have a complete picture for all the months, we here can see that there is a general increase in prices, perhaps occasioned by artificial shortages in markets, which have been as a result of the restrictions that have been imposed for due to coronavirus. We can see the same trend for milk. And the point I'm trying to raise here is that as the restrictions were being imposed, the supply was artificially disrupted, and therefore the prices went up. So what are the short-term effects of this coronavirus on food security? What we see then are changing consumption patterns. For example, we see increase in consumption of dry foods, the cereals, because when the restrictions were imposed, the first thing people went for were to go for foods that are storable, and there was a lot of panic shopping because the people thought that food will not move freely, and I think initially that was the case, but we are seeing now that most houses went ahead and stocked food in the houses to at least be able to survive the lockdowns. But we also see a depressed demand, especially because of the shutdown of the school system. The hospitality industry has been adversely affected. We're also seeing that as a result of the lockdowns and some people losing jobs or becoming underemployed, there has been a declining purchasing power of households. Secondly, we also see this disruption in the food supply systems as a result of the social distancing rules, and the dawn to curfew, dawn to dusk curfew, because most of this fresh produce are moved during the night, and with that enforcement of the dusk to dawn curfew, we see that has been disrupted, and that consumer prices have also been rising. Yet the producers are receiving lower prices because they are not able to offload much of the produce that they are producing, especially the fresh produce. We also see negative effects on production of high value produce. The supply of inputs have been affected, but also because, especially for the exports, we are seeing that those have also been disrupted to some extent, but also the markets and price uncertainty because of the imposed restrictions. We do not know how long this will last, but as long as we still have these restrictions, we are likely to see these uncertainties, and this will affect negatively the production of high-value produce. The long-term effects that we see are one, during the long-range production, we also expect disrupted supply of inputs. At least this year, the COVID set in when most of the producers had prepared their land, they had planted, and therefore we may not really see this much, but we do not know how long this pandemic will last with us and whether it is likely to recur. And so there is need for us to start thinking about how do we deal with those situations. So delays in supplies of agrochemicals have been experienced due to travel restrictions, and therefore this is likely to affect disease and pest control. But we also note that because of the ban on, the social distancing guidelines, extension has been adversely affected, and so we do see that happening. Also, labor has been affected. I mean, farm labor has been affected because of the, again, movement restrictions. But other long-term effects include high post-harvest food losses, and also reduced incomes as a result of the layovers and also loss of jobs. We are seeing reduced incomes due to the economic downturn. Of course, prices are likely to rise for consumers because of the artificial shortage of produce. And because of the market volatility, producers may also be affected, especially when they're not able to move their produce to the markets. So what then do we foresee as the way forward? What are our conclusions? One, we feel there's need to enhance access to the fresh food markets, rather than just closing them like some of the policies have indicated. We think that there's need to have them open, but these open air markets should, or these markets should have, infrastructure that can help to that will ensure health and safety of those who are working there, as well as those who are attending the markets. We also are recommending that there's need to sensitize and enforce guidelines all over, and that means that we also need to continually support innovations in the supply chain. One thing that happened over this period in Kenya, for example, was the increase in online shopping, especially in the urban centers, as well as cashless payments. And those should be encouraged, they should be supported, so that even though we might be having those restrictions regarding movement, we can still transact business. There's also need to support innovations for safe food storage. We know that in the rural areas and most of our markets lack some of those facilities and infrastructure. They lack, flowing water. They lack refrigeration in order to keep food fresh. So there's need in long term to address those, to reduce the post-harvest losses, but also to the food wastage that we often see in those markets. There's need to support producers. In this regard, the government recently announced some stimulus package that would help to address the farmers, the smallholder farmers' concerns. But this needs to be strengthened so that farmers are able to access inputs, they are able to access extension services, but also access information. And also there's need to track the prices and be able to provide better information and incentivize the food distribution system with the efficient, relevant information that can help in making decisions. And finally, there's need to provide safety nets programs, because a number of consumers and producers will have been affected because of the pandemic. But in order for this to be effective, there's need to have better ways of identifying and tracking those needy households, and then providing cash transfers to allow for the optimization of purchases at the house level. So those, in short, are my remarks and my highlights of how we can address the issues around the COVID-19 and help enhance and ensure food security within the region. Thank you very much.
much, Miltone, for that very comprehensive overview. I had a problem with my internet connection, so I missed some of it. I apologize for that, but I seem to be back up now fine. So in the interest of time, I'm going to move on and to invite our second speaker, Professor Rachel Bezner-Kerr, if you would like to give us your perspective, please. Thank you, Rachel.
Thanks very much, and thank you so much for inviting me to this panel. I'm really honored to be a part of this esteemed panel. And I have had long-term experience doing participatory research with smallholder farmers in Malawi and in Tanzania. But in addition to this long-term experience, I've also had the honor of participating on the high-level panel of experts for the UN Committee for World Food Security, and in the past 2 years, and co-authored a report on agroecological approaches to address food security and nutrition. And currently I'm one of the coordinating lead authors of the Working Group 2 of the Intergovernmental Panel on Climate Change. We're focused on climate change impacts, vulnerability, and adaptation for the chapter on food systems. And so it's from these two perspectives that I'm going to be talking, in addition to the long-term experience in Malawi and Tanzania. I won't spend much time talking about the impacts on Malawi from what I hear from my colleagues in Malawi, because Dr. Milton has really given us a picture of some of the impacts. And certainly there's similar impacts in Malawi, with not only the, the shutdown of hotels and restaurants and others in the tourist sector having ripple effects in terms of job loss, but also people returning from South Africa and other countries, those people out of work, and that job loss having ripple effects throughout the economy because others relied on their support for food security, and those who rely on the informal economy having been particularly hard hit. But in the rural areas, people have also struggled with having less labor available. They had previously relied on informal labor networks, so they haven't been able to bring in as much harvest in Malawi, which is about 80% of people are smallholder farmers in Malawi. And they also, in some cases, harvested their crops early, which led to reduced harvest. They lost some of the harvest as a result. So we were asked to think about what are some of the ways that we can respond to what we anticipate to be a rising food crisis following COVID-19 or in the midst of COVID-19. And I have 7 different suggestions, and I haven't prepared a slides. I thought I would just walk you through them. And those suggestions begin with agroecological approaches to addressing food security and nutrition. And agroecological approaches involve using ecological ways to grow food. So relying less on purchased inputs and more on locally available resources, things like manure and compost, and incorporating legume residue, but also diversifying crops so that you're not reliant on one crop, which reduces your risk, and incorporating methods such as mulching and agroforestry, and using botanicals instead of synthetic pesticides. In our long-term work with thousands of farmers in Malawi, and we've also worked with hundreds of farmers in Tanzania, we've shown that this approach, combined with attention to gender and other social inequalities, and doing participatory research with farmers so they can test what methods work under their conditions, has led to improved soil health, increased food and increased food security, and improved nutrition, and increased income for farmers who would have to rely less on purchased inputs. So these small-scale producers may be better able to weather the storm of COVID-19 because they don't have to rely on purchased input, and they have a more resilient food system that they can turn to. The United Nations report recommended that agroecological approaches be supported and broadened to help ensure a more resilient food system in the long term for Africa and globally. And this message is more relevant than ever. In addition, my second thought around how to address the growing food crisis in Africa is one that Dr. Milton has already noted: the need to strengthen regional and local food systems so that there isn't this over-reliance on global food chains. Dr. Milton noted already the current high reliance on imported food, which in fact isn't something that occurred naturally, but arose from explicit policies such as structural adjustment and the World Trade Organization, which imposed export-oriented agricultural policies and reduced support for local producers. And also with the influx of cheaper food products from abroad, suppressed demand for local products. So some of the ways that we could envision supporting local producers includes some of what Dr. Milton referred to, supporting innovation, helping them make linkages with urban consumers in new ways, and supporting things like consumer cooperatives, helping them develop safe protocols for local fresh markets, and redirecting subsidies so that small and medium-sized producers who produce the majority of food for Africa already are able to continue to produce diverse foods and not just cereal products. So this is a second point. My third recommendation or suggestion and reflection based on this long-term work is addressing gender and other social inequalities to ensure that food security is protected for vulnerable groups. So some of those steps include building or strengthening social safety nets for people who are more vulnerable to food insecurity. Things like school feeding programs or conditional cash transfer programs that have already been shown to be quite effective to ensure that those people vulnerable groups don't go hungry. But there's also ways to try to address those people working in the informal economy and really making sure that they don't get left out. Another group that is really at risk during COVID-19 are refugees and areas that are already experiencing conflict. Previous reports from the FAO have shown that those regions that are experiencing conflict are already experiencing high rates of food insecurity and malnutrition. And so attention to those areas and really trying to protect refugees and other people who are displaced from conflict is really important. And then building ecological resilience into the food system. The IPCC has made it clear that Africa is highly vulnerable to impacts of climate change, and COVID-19 is only going to exacerbate those impacts. So Dr. Milton already spoke about increased droughts and floods, and we know that that combined with rising temperatures and the associated heat stress, not only for workers, but also for livestock, all of these are anticipated to increase food insecurity across the continent, and some of this impact has already been felt. So finding ways to build a more ecologically robust system, and there's lots of tools in our toolbox that we can turn to, things like incorporating more organic material into the soil so that it can withstand drought more effectively, diversifying the number of crops and the number of animals that farmers have so that they reduce their risk, and relying less on synthetic chemicals and more on organic methods that are locally available are ways to build a more ecologically robust system, which will also help communities weather these unanticipated crises such as COVID-19. But a trend that has arisen not only in Africa, but in many parts of the world has been, with COVID-19, this dangerous combination of rising authoritarianism and misinformation. In some countries, including in Malawi, COVID-19 has become politicized, which is really complicated, and also here in the United States, where I am at the moment, which is really complicated response to it, where you have misinformation and rumors, but also distrust of authority and of the kind of information that people are receiving. And so finding ways to democratize the food system and ensuring that there's a voice for vulnerable groups and ensuring that they have enough information to understand what's happening is really important. And that means working closely with civil society groups and social movements to ensure that these vulnerable groups are part of the solution to rebuilding the local economy and rebuilding the food system. in light of the impacts of COVID-19. And related to that is fostering more effective and accessible science education, health, and communication systems. This lack of trust in social and political institutions that you see in some countries across Africa and other parts of the world is in part due to many years of conflict, weak democratic institutions, and low science education levels. But finding ways to do peer-to-peer learning and knowledge sharing is not only going to help in response to the pandemic, but is going to foster innovation in the food system. So in our work in Malawi and in Tanzania, we've done a lot of work around building farmer-to-farmer training, farmer-to-farmer networks, developing curricula so we can teach about things like climate change and health and nutrition. And these kinds of innovations around horizontal learning and citizen science are really crucial for ensuring that people are able to respond effectively and understand when they're getting new information about pandemics and can operate safely within the food system. And then finally, I think investment in the food system, not only in the short term in terms of humanitarian response, but in the long term, building this more socially and ecologically resilient system is really crucial. A recent commentary in The Lancet estimated that over $8 trillion has already been committed as a COVID-19 response in 10 weeks. And so we know that governments can mobilize vast resources when they feel the need. The Global Commission on Adaptation estimated that if there was an investment in 1.8 trillion over 10 years, so we've seen an investment at 8 trillion in 10 weeks. And the Global Commission on Adaptation said if there was an investment of 1.8 trillion over $1.8 trillion, over the next 10 years in 5 areas, including food security and agriculture, it would lead to net benefits of 7 trillion associated with avoided losses, reducing risk, and increased productivity and social environmental protection. So if we can mobilize as a globe that amount of money, 8 trillion US dollars in 10 weeks, surely the global community can find less than a quarter of that over 10 years to invest in the world's future food system. There have been many reports over the last few years talking about the urgent need to transform our food system because it's already not working, and it's certainly not working for many in Africa who experience food insecurity and malnutrition. And so not just any investment in the food system, but one that builds this more ecologically and socially robust and resilient and democratic food system that ensures that all Africans are healthy and well fed, and that small scale producers are really supported, and that small-scale food businesses are supported. So with that, I pass over the mic.
Thank you so much, Rachel. That was a great run through of a list of key points very succinctly. Thank you. So I'd like to just move over very quickly to our third speaker, Dr. Leena Koni Hoffmann. So Leena, if I could hand over to you now, and you have the floor.
Thank you.
Thank you.
Just unmuting now. Hello, everyone. Thank you very much for inviting me to participate in this panel. There has been quite a lot of meaty presentations from Dr. Ayieko and Professor Kerr. I think a lot of, in terms of like the recommendations and implications, have been robustly covered, but I think I will use my time, the next couple of minutes, around about 10 to 12 minutes, to really kind of talk about 3 broad themes that I think will be helpful for us in understanding the context of the food situation in the Sahel and West Africa. So I'm speaking from the perspective of my work at Chatham House. We have done work on cross-border trade in West Africa, looking specifically on Nigeria, where I do my work the most in terms of a country theme, looking at Nigeria's external trade relations with its neighbors. I also work with the Permanent Interstate Committee for Drought Control in the Sahel. So looking in that work, I do work around food security policy across West Africa and agricultural policy, and also working with a lot of the technical expert groups that monitor the food situation in the region. So I'm going to be speaking not just about the countries that lie along the Sahelian belt. I think it'd be more useful for us to have a more robustly regional focus. So looking at the 17 countries that make up the West Africa region that belong to either one or more regional or sub-regional communities. And I'll first of all give an overview of the context for COVID-19 in West Africa, with a focus on the vulnerabilities that were present wholly separate from the virus itself. So looking at the pre-existing situation that's now been layered with this pandemic, and really just the situation of it just being layers of crises happening, unfortunately, all at the same time. I will then outline some of the impacts of the pandemic on food systems in the region. And finally, maybe flag a couple of measures by governments and some local action or subnational actions that are noteworthy. But I'm sure we'll maybe have some time to speak a bit more in the Q&A. So on COVID-19 in West Africa, as at yesterday, I didn't check the figures today. There are around about 31,400 confirmed cases of COVID-19 in West Africa. That's according to the OECD Sahel and West Africa Club. We do know that testing rates are very varied across the region, and we know that they're generally low. So we don't really know the full picture of the health crisis itself. All we know is that it spread fairly quickly. In under a month, it had spread to all 17 countries in West Africa. And what we also know is that back in December of 2019, before the pandemic, the food and nutrition situation was already pretty alarming. So lots of networks and food crisis networks and monitoring units have been pretty concerned about the numbers of people who are at risk of food crises and various stages of food emergency. So since 2011, more than 92,000 people have been killed in North and West Africa in over 20,000 acts of violence. The past decade of violence has had quite devastating humanitarian consequences. So we're talking about the numbers, really high numbers of internally displaced people. That has increased exponentially in parts of Burkina Faso, Mali, and Western Niger. There's been a four-fold increase in just a year. Around about 1.1 million people have been displaced just by this February of 2020. And a similar situation has played out in the Lake Chad Basin area and Liptako Goma area. Many, we're talking in the hundreds of schools and health centers have been directly targeted by armed groups. And this has left many communities facing quite extreme food and nutrition stress. So in April, early April, as a result of the pandemic, we weren't able to have the food crisis prevention network assessment altogether on the ground. So it was done virtually. And the food crisis prevention network is coordinated by the OECD Sahel and West Africa Club. And it monitors the food situation throughout the year, along with ECOWAS and UEMOA and the Permanent Interstate Committee for Drought Control in the Sahel, which I've worked with. So the Food Crisis Prevention Network announced that around 11 million people were in need of food and nutrition support, and 17 million people were facing food crisis between now and the lean period, which is coming up in June in a week, and August. And this was mainly due to insecurity. And these numbers have been supported by assessments as well by the UN World Food Programme. So a further concern for the food situation, and Dr. Ayieko has quite well laid out how the risks of the desert locust infestation in East Africa It has devastated East Africa, and it is pushing westward. So that is a concern for West African agri-food systems. Already they are under strain from an armyworm infestation, and lots of early warning systems are monitoring the movements of the desert locust from East Africa to West Africa. So if you were to factor in climate change impacts, which have made soils less productive and put pressure on pastures for livestock, competition between crop systems and livestock systems, and you'd think the situation couldn't possibly get worse, and then COVID-19. So figures from the Food Crisis Prevention Network and the WFP estimate that between 43 and 50 million additional people could fall into food crisis if COVID-19 becomes a compounding factor. So 50 million people in a region, about 380 million people, majority population in Nigeria, the most populous country in the region, and of course in Africa. What's most concerning, though, in terms of the pandemic impacts, stem from the direct and indirect impact of the situation with the global economy. Very poor and food insecure countries in West Africa are being hammered by the drop in commodity prices, the wipeout of remittances, the tourism sector being decimated, and quite serious brakes being put on trade, which is affecting foreign exchange reserves for many of the countries in the region. Disruptions to food supply systems have disruptions to supply systems have impacted food imports in particular. We see that in countries like Benin, Liberia, the Gambia and Senegal, whose food imports exceed their exports by about 50%. So food prices have gone up, and they've been going up since the beginning of the year. And there's a real prospect that food prices will continue to go up as the region moves into the lean season in June and August of this year. And in all of this, Nigeria stands out for a number of reasons, and I'll just outline a couple of those reasons. 90% of its export revenue and foreign currency earnings are derived from oil. So the drop in oil prices has left quite a ginormous hole in the government's revenue. The Nigerian Central Bank has devalued the local currency, the Naira, and that has led to people's purchasing power evaporating almost overnight. Back in April, the Food Crisis Prevention Network estimated that about 7 million Nigerians will face a situation of food emergency in June, particularly in the Northeast region that's been affected by the Boko Haram insurgency. And Nigeria stands out for other illustrative reasons. A big one is also as an example of the scale of the food economy in West Africa. Food is the largest economic sector in the region. It accounts for more jobs, the most number of jobs, biggest chunk of household spending. For example, in Nigeria, in 2019, Nigerian households spent 56% of their income on food. In urban areas across West Africa, 1 out of 3 people work in the food sector, with most jobs being done by women and young people. So they are the vendors in the shops, on the street corners, hawking and selling convenience food across urban and rural areas, most of them working in the informal economy. The informal economy itself represents between 80 to 90% of the economy of West Africa. And these jobs are facing different degrees of stress, but each one is vital to the urban food economy and ensuring food gets to urban households. Poor urban families are particularly reliant on food supply chains because they tend to buy small quantities of food on a daily basis, usually using income that was earned on a daily basis. So when we're talking about, okay, how in the midst of these kinds of food, these food systems, what we've seen is that the first action of governments has been to, besides health checks along the borders that have been facilitated by the regional organizations like ECOWAS and the region's World Health and region's health organization, WAHO, one of the first actions alongside those health checks were border closures, which are followed by market restrictions and restrictions to movement for private and public transport. But the thing is, these actions immediately disrupted food supply chains, affecting in particular the flow of imported food going to rural areas and farm produce going the other way. And a lot of the food that goes both ways, so to markets in rural and urban areas, moves informally. So frequently in small quantities using public transport vehicles and so on. The mobility restrictions have hit small businesses the most across all the sectors, but in particular, the food supply chain. Farming activity in rural areas may be slightly cushioned because a lot of the labor on farms in rural areas depends on farm labor. But then farming activity in rural areas has been affected by conflict, by banditry, by clashes between farming communities and herding communities. And but for medium and large farming operations, there's less of a cushion to the impact of mobility restrictions, because a lot of these operations depend on seasonal workers, and seasonal workers not being able to move at this particular time has real implications for upcoming harvest and farming cycles. So besides shining a spotlight on food insecurity in West Africa, COVID-19 reveals really starkly how informal, how decentralized, and how fragile yet connected rural and urban to rural food systems are in Africa. And my colleagues, Dr. Ayieko and Professor Kerr, have elaborated on that quite extensively. So I think I'm quite glad that what we're talking about most this afternoon is about food rather than talking about the pandemic. The reality is that the scale of the food insecurity situation across Africa, as we have outlined collectively, is way above and beyond that which government food aid or distribution of food aid can address. There's simply too many hard-to-reach populations, and most people in cities rely on markets for their food. And it's really, really hard to assess the vulnerabilities a lot of informal workers that reside in urban areas. So targeting urban areas and urban food insecure households and people is particularly difficult, given the fact that a lot of governments in West Africa and across Africa have very limited tax data or tax information or employment or social registers of people, even within, particularly within the informal economy. So in terms of the scale and the location of populations that are affected by the food situation, distribution of food aid is would be an unsustainable strategy. In the short term, limited in impact, and certainly not effective for the long term, particularly for densely populated areas. So about 40% of West Africans live in cities, and many of these cities are unplanned, poorly laid out. So it's practically almost impossible to get food to families that will otherwise work for their daily food. So again, the current context shows how important it is for governments, and I think just to echo what Dr. Ayieko was saying earlier on, was for governments to focus on freeing and facilitating food supply systems, especially the ones that reach urban markets, to avoid prolonged hunger crises in these areas. Large markets, again, can operate safely with proper sanitation and hand washing facilities. It is really important to focus on providing hand washing facilities, because 1/3 of West Africans do not have access to clean water, and water for the kinds of the regularity of hand washing that is required in the midst of a health crisis such as this. So just finally, there have been quite some notable regional coordination efforts around the pandemic. I think there was an assessment by the European Commission Financial ECDPM. I always get the acronym upside down, but I will share the link to the report that they put out, I think, a couple of days ago on assessing the response by regional organizations, and one of the ones that was highlighted in terms of its centralizing role and its capacity, its improved capacity and resilient capacity for disseminating information and communicating and working with governments was ECOWAS. So back in April, ECOWAS, that's the Economic Community for West African States. ECOWAS ministers in charge of food and agriculture set up a high-level task force to monitor and coordinate their action plan. They've also asked member states to allow agricultural inputs and produce to move freely across borders. They've also encouraged governments in the region to maintain or even increase funding for agriculture. So despite budgetary pressures from insecurity and the health crisis itself. But the thing is that as much as ECOWAS and other regional bodies and the AU have been very active at this time and very dynamic in the way in which they engage with international community or global communities, they can only mandate action. They cannot mandate action, rather. Responsibilities lie with individual countries, and individual countries have various constraints and very diverse local dynamics. There have been, I'll conclude on this point, there have been issues of synergy on the ground between federal and subnational authorities. So that is why highlighting the importance of food moving freely across the region is particularly important. I think a final point to make, the situation, the current situation and the ways in which African countries and African RECs would need to respond, I think it's worth highlighting that there is quite a robust opening for boosting African, intra-Africa trade through the African Continental Free Trade Agreement, to diversify revenue sources, strengthen and build resilience in agri-food systems now. And it's worth underscoring how dynamic and effective local initiatives have been in filling the gaps where government has been inadequately, having inadequate capacity to reach. So in using ICTs for home delivery, food services, civil society actors, helping with information sharing, manufacturing hubs, for example, in Southeast Nigeria, producing personal protective equipment and masks and so on. So all of these actions have highlighted or underscored a lot of what communities across West Africa have learned from other outbreaks such as Ebola, that local action makes a difference, regional action is important as well. So just on that note, I will conclude. Thank you for listening.
Thank you, Dr. Hoffmann. I really appreciate those comprehensive points. And I think our three presenters have all used a little bit more time than we were anticipating. But I think it's been very helpful because it's given us a very comprehensive overview of the context to the situation, and then a lot of very interesting points about the immediate crisis that we face and the way that is developing into, well, from the COVID crisis into this food security crisis, and very sobering thoughts about the way that may play out over the next couple of months. So the idea originally was that we'd have about 20-minute discussion now and then take some Q&A, but I think we'll shorten the discussion and move to the Q&A a little bit faster than planned. But firstly, I did want to make two points really just to follow up from the presenters, and the first of those is about just identifying some of the immediate actions that are really quite critical. I work a lot in the climate world, and we're interested in forecasting and early warning of the implications of droughts or other climate hazards for food security. There are many quite sophisticated systems across Africa for early warning, particularly for food security, and those rely on both technical information coming from satellites and models, but also significantly from people on the ground monitoring markets, looking at prices, looking at farmers' behaviors and the yields as they're reporting them in markets and so on. And those feed through into the pipeline and early warning for humanitarian crises around food security. But clearly, many of those are reliant on the ground activity, and I don't know. I'm interested in to what extent the COVID response is constraining our ability or the ability of those early warning systems to effectively pick up on crises as they occur. And the early warning is clearly going to be critically important over the next couple of months, and we've heard there will need to be a massive scaling up of the current system, and how that can be done under restricted movements and so on is an important question. And the other point that I wanted to raise, and for comment by the panel before we move to the Q&A, was just about the previous events such as the food price spikes in 2007, 2008, and whether there are lessons that we can learn from the way that countries individually or collectively responded and coped with that event that might be relevant for our planning over the next couple of months. So I'll give the panelists an opportunity just to respond to those 2 points before we then move to questions from the audience. So would you, panelists, would you care to comment?
So let me just briefly, Prof. I think as you rightly put it, early warning systems are very critical, especially for us to ensure food security. And I see your 2 points are very closely related. Looking at the past shocks that we've had in 2008, 2011 in Kenya, and 2018, some of the worst droughts that we have ever experienced. The understanding is that we should be able to learn from some of this experience so that we are better prepared and equipped in order to respond in a time manner to minimize the effects of these shocks. But honestly, I think we still have some yardage to cover, because most of the responses have always lagged in terms of timeliness. And so, for example, if we are able to respond very quickly to those early warning systems, we should be able, for example, in a normal year, we should be able to know the frequency of droughts and how that could have to have adequate stocks that can last us until the drought is over. Or in the case of the locust invasion, I mean, if we could be able to use those warning systems, we know that they were breeding somewhere in Yemen, and that they would move. Their movement could have been anticipated, and then the countries could have been well prepared when they get into those countries in the countries themselves. But we see that we didn't use very good. We didn't make very good use of those early warning systems. So there's need indeed to do that. In the face of COVID, movement has been curtailed. Therefore, even gathering this information and feeding it into the system is difficult. But I see here where now use of technology can be of essence, can be used. Use of cell phones where we are not able to reach, those on the ground can be able to give some information that can then be collated and fed into the system. In my view, I see there's a lot that we can learn from the past. But if we just leave it, in books, that it doesn't feed, it doesn't help us in decision making, then we will still be facing food insecurity in Africa for a long time.
Mm-hmm. Okay, good. Thank you. Rachel or Leena, do you want to add anything before we move to questions? Rachel.
I mean, I think just to echo the critical importance of having more effective early warning systems is really, it's really important. And I think relates to my point about the need for strengthening communication systems and building in, linking it to science and education and sharing information across the continent. So yeah, I think that is really important for being able to respond more effectively, so we have a better sense of what's happening. But I think I pass it on to Dr. Hoffmann in case she has anything to add.
Well, I'll do some echoing as well, but then I will flag for West Africa in terms of lesson learning. There has been quite robust developments around in response to monitoring drought conditions and preventing droughts like the devastating drought in the region of 73. So the Permanent Interstate Committee for Drought Control in the Sahel was birthed out of that, as well as the Food Crisis Prevention Network that I spoke about some of their data when I was doing my presentation. But also in December of 2012, there was the Ayieko was launched, so that's the Global Alliance for Resilience in Ouagadougou in Burkina Faso in 2012. And the idea for Ayieko was about improving synergy and coordination across the region and for supporting West African and Sahelian governments to design their own resilience initiatives and develop their own resilience, national resilience plans. I don't have the numbers off the top of my head, but I think at least 50, maybe up to 70% of countries have developed their resilience plans. So the idea being to learn from the past and be prepared for the future. I think the challenge for a lot of these regional and cooperative endeavors has been in getting national governments to keep their eye on the ball, planning for the future, averting risks that seem to be far away in the future, don't really fit into 4-year political cycles. It's really hard to get that kind of focus. And then, like I said in my presentation, there are not always the kind of immediate incentives for governments to plan for a future that they perhaps aren't in control of. They're in and out 4 years for some, not all, West African governments. So it's been slow in terms of like learning from the past. The learning has been slow, but I have to say it's been steady. If you were looking for seasonal data, if you were looking to understand how market systems are connected across West Africa, if you wanted to understand the climate picture, climate situation, potential predictive data. They are early warning systems, like you said earlier on, that are useful and have been effective. And these are the systems that are being drawn from for particularly like the task force that's been set up by the ECOWAS ministers of agriculture. And I think there is another high-level task force that has been put in place to monitor the food situation as in this very, very fluid, fast-changing time. So these coordinating bodies exist on the regional, in the regional landscape. Their effectiveness and their impact on policy, national policy, is where, you know, there more needs to be done, or more needs to be seen to be done. I think the hope is that given the pandemic and the ways in which emergency funding and cooperations are coming together quite quickly, there might be an opportunity to build quite sustainably systems for the future.
Yeah, I think that's a nice optimistic point. I think that the momentum that this is generating may well help some of these long-lasting barriers to particularly the importance of coordination and communication and working together in these areas. I mean, we're seeing this in the global north, but of course they apply equally in many parts of Africa. So let's hope that momentum will overcome some of those things, and we'll see some longer-term positive changes that come through the current crisis. All right, thank you. So I'm going to take two questions. The first is from Dr. John Mathandi from Malawi, and he gives a bit of background about the travel restrictions. Despite travel restrictions, his company is receiving orders for many tons of food from companies in Kenya. He's based in Malawi, but unfortunately maize and all its products, including husks, is under a ban in Malawi. And as I was processing papers for rice to export to Kenya, was told that rice too is under an emergency ban for this year. So his question is, can regional blocs such as COMESA or SADC discuss this at a higher level meeting to have an emergency plan for regional food security, which very much touches on this point of coordination, which is going to be critical. So that's one about national to international within Africa coordination of food imports and exports. And the second one comes from Sautra, who is an advocacy champion of girl-powered nutrition in the World Association of Girl Guides and Girl Scouts, and she's from Malagasy. She's Malagasyan. Before lockdown, students in primary school got a healthy plate for lunch and nutrition education, but actually they haven't had access to this healthy food and to this education during the lockdown. So in addition, our people don't have access to information released using communication systems such as social media, television and radio. And due to the food crisis, products in the market are becoming more expensive. So her question is, how can we give support in education for nutrition and food access for students, girls, and for all? So particularly those in vulnerable circumstances. We've got a question there about coordination cross-border in terms of food, and then we've got a question about education for marginal groups, vulnerable groups around nutrition and food access.
I can
go. Oh, go ahead, Rachel. Go ahead.
I can't speak to the first one. I think you should take that first one, but I can just mention for the second one, I think it's a big challenge, but I think it's really important. I know that here in New York, with the schools shut down, there have been home deliveries of school meals to families that rely on reduced or free school lunches. And what that might look like in different parts of Africa, I don't know, but I think that finding ways to reach those families that have relied on those children that have relied on those meals, I think is a really crucial question. So I don't know if some of our other panelists know of strategies that have been undertaken, but I think that trying to ensure that they are reached is really important.
Thank you. Let me attempt the first one on the regional blocks and how they can help to unlock the movement of food across the borders. I think the challenge that we have here, yes, the regional blocks can actually come up with ideas, but the measures are taken at country level. So we know that the region, relies very heavily on food from food surplus areas to food deficit areas. Malawi supplying maize to Kenya, and Kenya and Tanzania and Uganda are trading, food crossing the borders. But when decisions are being made, they're made at national levels without consultation of the neighboring partners, then it becomes very difficult to implement. I mean, at a very high level or region. So yeah, I think there's need for coordination between the government. For example, when Kenya or Tanzania puts a ban on trucks crossing the border, and these are the trucks that are bringing food or bringing food to areas where they're needed most, then you see that affects the food supply. And therefore, I think there's need for that coordination in order to ensure that food can easily move during very uncertain times of the COVID-19. Thank you.
Dr. Hoffmann, do you want to come in there and respond?
Just quickly add to that. Of course, not able to speak to the first question on coordination in East Africa, but to just to the second question on school feeding programs, I think again, a number of countries across West Africa have tried to address the problem or the issues of getting food to children who needed or usually had meals in schools by doing what Professor Kerr said happens in New York, getting food delivered to various homes, or having households in some kind of organized fashion, maintaining physical distancing, of course, coming to pick up that food, but then given the numbers of kids and families that need assistance, to the point I was making earlier about distributing food being a challenge, given how densely populated a lot of urban areas are, where most kids are going to school, etc., etc. But I think I wanted to comment on this question just to highlight as well, in my understanding for what's happening in Nigeria, the government does have a school feeding program that has been rolled out. It's pre-pandemic, and they've had to confront this challenge of providing school meals to school children at home. And I think they've tried to integrate it with their conditional cash transfers. That is also another program by the current administration. So just trying to ensure that some kind of support gets to families and food gets to children who would have had these meals in schools. Of course, like I tried to say in my presentation, social registers still, although it is definitely a positive development that there are some social registers, but these social registers cover just a few 100,000 households. We know households that are vulnerable at this time exceed that number. And I think there is also the issue, and I think a number of civil society and anti-corruption organizations have been trying to draw a lot of attention to this, is the need for transparency in the distribution of all of this money and food, in the procurement of the food and the procurement of all of this assistance. And I think it would be remiss of us to have a conversation about addressing emergencies and responding to emergencies in the context of Africa without highlighting the challenges or issues of corruption that are likely to put food further away at a distance from people, from households and individuals who need it the most. So I imagine most families, most households rely on their social networks. They will rely on churches, their religious communities, mosques. A lot of private individuals have stepped in. So I think the final point I was making in my presentation was just along the lines of just a lot of this local action and communities stepping in to fill in the gaps, which is not unusual for a lot of countries across the region, across Africa, that people rely on their immediate communities for help when they're in a difficult situation. So communities have been rallying together to support less fortunate ones amongst them, providing food services, and as well trying to provide sanitary facilities. So I think if there will be the victory or the success of stemming the spread of the virus, I think the true heroes or the true champions of it would be local people organizing, community organizing to address the response, the health crisis itself, but as well the food situation as well, the food crisis and nutrition crisis as well.
Okay. Great points. Thank you very much. I'm conscious of time, so I don't think we've got time to take any more questions. But there's a lot there. There's a lot around the immediate responses and ideas about what works well, the opportunities for credit to reach small-scale farmers and so on. Very important issues. But I wanted to wrap up, because we need to finish now, with just a thought, and if any of our three panelists want to respond very quickly, then they're welcome to. It just strikes me that this has been quite sobering. Obviously, the focus has been on COVID-19 and the health dimensions. We need very clearly to shift to a rapid and major scale up to be thinking about the food security implications over the next few months. And to what extent can we use experience from the past of linkages between health and food security with HIV, with Ebola, to maximize the coordination and the handover, if you like, of some of the activities and the planning and implementation from health into food security, and that's going to be a critical process over the next couple of months. So on that note, I think I will finish, because we're now over time, and I want to thank everybody out there, the participants, for your tuning in and listening, and the very interesting questions that you've provided with us. There will be a recording of this, which is available on the website. And then I'd like to thank our three panelists again, Dr. Miltone Ayieko, Professor Rachel Kerr, and Dr. Leena Hoffmann. Thank you so much for taking the time to prepare for this and to give your presentations and your thoughts on the issues. So a virtual round of applause from myself and everybody else. We really do appreciate your inputs. Thank you so much. And that's it. I think so. Thank you so much. and we will wrap up now. I don't know if there are any messages from the organisers, or if you want to say bye-bye. Okay, thanks very much.
Thanks very much.
Thank you.
Thank you.